All right, welcome to Maximus Live, episode 81. Can't believe we've done so many of those shows. I'm your host, Dr. Cam Sapa, CEO of Maximus. I'm also a licensed clinical psychologist and psychiatry professor who's an expert in health and performance optimization. So I have a private practice working with CEOs and VCs, optimizing their diet, exercise, sleep, focus, and relationships. And also as part of our company, we do hormone optimization for men. So every week we do this weekly call-in radio show where we answer any and all questions having to do with health optimization in terms of how can I be a healthier, more virile and virtuous man, and take questions from the audience. Hopefully we'll have a couple of folks join us today in the Zoom that we can do Q&A. If you have any questions and are joining us on Instagram Live, feel free to type in your questions and I'm happy to answer them. And shout out to everyone who's joining us on Twitter Spaces and YouTube Live as well. So every week we start out with a weekly unpopular opinion just to get the juices flowing. And this week's unpopular opinion is that ice baths are bad for your balls. So there's a lot of influencers out there that keep promoting ice baths, cold showers as like the fountain of youth for your health. And I look at things in terms of a very hormonal lens through the company, in which some practices can be good for some things, but they may not be optimal for hormone health and fertility. And I actually think that's probably the most useful biomarker to look at, because if something is bad for your testosterone or sperm count, it's probably not optimal for just overall health, because obviously one of the main functions of human beings is not just to survive, but to successfully reproduce. And so if something's negatively affecting your hormones and your fertility, it's of questionable, I would say, benefit, especially from an evolutionary perspective. So there's a very interesting study done on this topic. And even though there are other studies that show other benefits for, ice baths, cryotherapy, etc., I was particularly interested in the question of what does cold stimulation do to testosterone? And so this study was done in 32 males that were young. These are on average 19-year-olds. And look at the effect of exercising, which is kind of a positive intervention, and cold stimulation on their testosterone and luteinizing hormone. Luteinizing hormone is essentially the precursor to testosterone that's released by your brain that signals to the testes to produce more testosterone. So they looked at the effect of exercise. They had them go on an exercise bike at 90 watts for 20 minutes. Kind of standard moderate intensity exercise, found that testosterone significantly increased. And we know this, that acute exercise, you get a nice little testosterone spike of 21%. Luteinizing hormone increased by 3.6%. And noradrenaline increased by 140%. So you got a dramatic rise in adrenaline, which makes sense. You're exercising, it's stimulating the fight or flight response. Now, these acute fluctuations in hormones are nothing to sing home about. Watching your favorite sports team win or seeing an attractive woman will also typically stimulate testosterone. It doesn't mean you're going to build a massive amount of muscle just from these sort of transient blips up and down. But it is interesting to understand, if you are doing an acute activity, what is the sort of the physiological effect of that? Now, interestingly, in contrast, when these young gentlemen were engaging in cold water stimulation or cold exposure, testosterone actually dropped by 10%. Now, interestingly, luteinizing hormone increased by 22%, and noradrenaline decreased by 24%. Now, this is a little bit paradoxical. Typically, when you see luteinizing hormone increase, you see testosterone increase as well. But in this particular case, you see the opposite happening. The brain is kind of stimulating. Now, it may be that testosterone is dropping, the brain's trying to compensate by producing more luteinizing hormone, or the cold may be sort of shocking the testes a little bit in being less responsive to the luteinizing hormone signal. So it's unclear why they didn't study sort of that, but it sort of was an interesting contrast to exercise, in that basically exercise increases testosterone, while cold stimulation slightly decreased testosterone. Now, is that a clinically meaningful decrease in terms of a 10% decrease in testosterone? Not really, but it was a statistically significant effect. And in general, though, I think it paints a little bit of a cautionary picture of like, hey, you know, in contrast to other behaviors that you could be doing, which increase testosterone, certainly cold stimulation is not helping and, in fact, may be hurting. So that's kind of the physiological effect. And then what about like the practical effect? Don't a bunch of professional athletes take ice baths? And I actually looked this up because I was wondering what is the best practice amongst elite athletes. And there was an interview done by the guy who is the Associate Director of Clinical Research and Multidisciplinary Care. His name is Dustin Nabhan at the U.S. Olympic Training Center. So this guy works with Olympic level hopefuls and helps dial in their protocols. And I think they're a good example of what you should be looking at. And interestingly, he said, yeah, it may feel good to reduce your post-workout pain by jumping into an ice bath, but inflammation, acute inflammation, is important to healing. What we don't want is chronic inflammation. And so if you're hampering your body's natural response to training, which is a little bit of an acute inflammatory response because you're tearing your muscle fibers when you lift weight, you're actually limiting the gains that you're getting. So you don't want to block inflammation completely. And doing an ice plunge, literally, there's a quote, he says, doing things like ice plunges every single day won't help. So he actually says basically ice baths should be reserved for a hell week of training or basically after a competition. In that case, his athletes will soak in like by the way, it's a 50-degree tub. They're not doing like freezing cold, freezing water there for 10 to 20 minutes immediately post-exercise. And the reason they're doing that really is to reduce oftentimes injury or an inflammatory response from basically overtraining. Olympic athletes are often training for hours a day, or if they're engaging in competition, it can be up for hours at a time if you play sports like tennis. So I think those are extreme instances. And I always tell people, like, basically, if you're not an Olympic athlete, and I'm sure you go hard at the gym, bro, but you really don't need to be doing ice baths unless it's really medically indicated for injury purposes. You're not getting very much benefit, and quite frankly, it's uncomfortable. Nobody actually likes doing it other than for the bravado of how tough or masculine you feel. But I think the evidence is, to me, very unconvincing. A lot of the evidence is around very theoretical things like brown fat activation, which what does that actually mean? For people, I think that the potential benefits are very theoretical, and I don't think the overwhelming majority of people should be doing it because it's adverse for both your hormones and, quite frankly, it's unnecessary for peak athletic performance outside of high-level Olympic or professional athletes. So I am very bearish. I don't think anyone needs to do them. So spare yourself. Enjoy your nice hot shower. If you need to ice your injury, go just ice your injury. I don't think you need to go crazy with the ice baths. I think it's a very trendy thing because of Instagram, and I don't think the science backs it. So don't torture yourself with masochistic ice baths. And that's this week's unpopular opinion. All right.
We did have a question via YouTube. Hey, Dr. Cam, what is your opinion on mud water, specifically the mushrooms inside their mud water and the ingredients, including, let me get the list for you, lion's mane, chaga, reishi, cordyceps, and cacao?
Yeah, so ironically, I'm an investor actually in mud water, so I do have a financial interest that I will disclose. I'm a very minor investor. Doesn't really move the needle, but I like what they're doing. Not so much actually, ironically, from what ingredients they include, but what ingredients they exclude. I think there's just going to be a big movement away from caffeinated morning beverages, and I'm someone who's super sensitive to caffeine, so I was really just happy to see a company out there being putting out products that don't include caffeine. I actually think even though caffeine is, I wouldn't say it's unhealthy for you, the way that a lot of people use caffeine, I would argue, is unhealthy in terms of its behavioral effect, which is a lot of people use it to as a crutch essentially to mask chronic sleep deprivation. So caffeine is actually a performance enhancing drug. In fact, I believe excessive amounts of it at some point were banned by WADA because it enhances sprint performance. Um, and It does have some cognitive enhancing effects as well in terms of being able to do things faster, processing speed, so on and so forth. Even if you are using filtered forms of coffee or healthier forms of tea, green and white tea in particular, there may be some positive effects that come from the other chemicals in tea and coffee. So I would say neutral to positive health effects from caffeinated plant-based sources of caffeine. However, when you use it to sleep an hour less a night and function, I think it has a net negative effect. Where if you didn't have the crutch of caffeine, you would be probably sleepy and falling asleep at work, which you'd probably get away with acutely, but it would force you to actually go to bed on time because it's terrible to have to drag through the day and have your eyes flutter closed during a meeting if you've ever experienced that phenomenon. So I think mud water is a good example of a non-caffeinated beverage. Now, it includes a bunch of functional medicinal mushrooms, the lion's mane, the chaga, the reishi, cordyceps, and the cacao, which most people know as like cocoa if you've ever obviously had hot chocolate or hot cocoa. Cocoa is actually a really interesting, and I'm a big fan of it as a caffeine alternative. So even if you don't have the money for mud water, which is an expensive product, cacao does seem to have a lot of positive health benefits. It has it does have a tiny bit of caffeine, but for most people, unless you're super sensitive in it, usually not enough to have a stimulatory effect. Like I can't have caffeine; it'll mess with my sleep, even no matter what time of day I have it. But if I have hot cocoa, I can have it right before bed. Doesn't interfere with sleep. Interestingly, it has a compound called theobromine, which is in the same xanthine family as caffeine. And even though it's chemically similar, it actually has opposing effects to caffeine. Caffeine is actually a vasoconstrictor. People don't realize that it actually constricts your blood vessels, which is why, interestingly, that it's used in products like Excedrin that you may have heard of for migraines, because sometimes when people have migraines, their blood vessels are opening a little too much, and it makes them shut down, and it blocks or alleviates the migraine. But if you think about it, you're lessening blood flow to your brain by taking caffeine. So even though it's increasing cyclical AMP and making you more alert and stimulated, it's actually decreasing blood flow, which I would argue if you're doing more creative work, you may not want to do. Interestingly, theobromine is a vasodilator. It expands blood vessels and increases blood flow. So it's actually kind of a nice product hot cocoa is a nice beverage to have for doing sort of creative work. It's useful to throw in if you have some protein with your pre-workout. But the one downside of it is all cacao and basically chocolate is unfortunately contaminated with cadmium, which is a heavy metal that's soaked up by the roots of the cacao plant from the soil. So it's intrinsically in there, and I unfortunately haven't really found any low cadmium versions. Now, obviously, if you occasionally have some chocolate, it's not going to kill you. But if you're consuming teaspoons full or tablespoons full of cacao every single day for the rest of your life, I would worry about excessive cadmium exposure. The only product that I know of in the market, I believe it's produced by Mars, the candy company, ironically, is an extract supplement version called Cocovia that is low cadmium. So if you specifically wanted to take it for the nutritional benefits, you could buy that. It's readily available on Amazon. It has that positive benefit. But the other parts of the mud water in terms of the medicinal mushroom all have a fair deal of research behind it. I don't think there's research on the particular dosages and the combination that mud water uses, which is proprietary. So I wouldn't say it's an evidence based formula where you can point to particular effects, just like I was talking about with the cold water bath immersion. But I would just take it as this. It's a nice caffeine coffee alternative, tea alternative that's non caffeinated. The medicinal mushroom effect, neutral to potentially positive. I just don't know because of the quality and the dosages of the mushrooms matter a lot. But generally, it's a good brand. So it's generally I would consider them trustworthy. So I would just try it and see how it feels for you. But I think they put out generally a good product. Obviously, I'm an investor. They're doing pretty well as a company. So either make your own, which is how Mudwater was originally invented. The guy would just blend his own versions of adaptogens. So you can use hot cocoa or whatever you like. Or you can buy basically that as a pre-made version of it. All right, with that said, I'm going to bring on someone in our waiting room. Hey there. I think we are still connecting audio, so we'll give it a minute. Hi there.
Oh, what's up, Dr. Cam? How are you doing?
Good, good. How are you doing?
Not too bad.
Excellent, excellent. What's on your mind?
You know, been doing a lot of traveling recently, man.
Mm-hmm.
And, I quit my old job, and I'm looking for something better, better. And, I'm just trying to get back into the swing of things, and it's going pretty well, but I've embraced this philosophy of non-action. And it's all about observing without judgment and acting and deciding simultaneously. So it's not easy, but it's very simple, you see?
Yeah, absolutely. So, well, congrats on taking the first step in terms of, I know it's hard to sort of like leave a job. What were you doing previously and what made you want to take that step?
Oh, yeah, I was working with T-Mobile. And I was working with them through Infosys Limited, and I just didn't feel like I was really valued at Infosys Limited. Like, I feel like just because they gave me like a 2-week training course, they felt like they had dominion over me the way the Bible says that man has dominion over nature. Something like that. I don't know, like, you know what I mean?
Yeah.
I don't know, dude. I mean, it was just... And then Kishore, my boss, he kept calling me a resource.
Yeah, that doesn't certainly make you feel valued.
Nah, just every single thing. Like, Murphy's Law?
Of course.
Like, working with my bosses, HR, and just the overall company and, hierarchical culture as well as the work from home bullshit and sitting at a fucking screen being fucking indolent and fucking...
So, it sounds like a step away from certainly some of the negative energy that you were experiencing there. So, what do you aspire to? What do you think would feel more valued to you and more aligned with the things that are important to you?
Yeah, dude, I don't really know, man. It's hard to say. At first, I was thinking maybe I should become a firefighter for a little while. To learn valuable life skills. Act with courage and... Oh, also it was a metaphor, bro, because I was like trying to meditate on the fires of lust, hatred, and delusion.
Mm-hmm.
That's pretty hard to do. So,
Yeah, your call is actually very timely today because the rapper Coolio actually died today at age 59, and it was interesting.
Gangsta's Paradise, bro.
That's right, the Gangster's Paradise fame.
Show, my dude.
Interestingly, he he was kind of trying to find his way in life when he was a youth, which obviously he alludes to in Gangster's Paradise about not sure if he's going to live past 23 or 24. But interestingly, because he dealt with some addiction issues, I believe he was addicted to crack cocaine and other things. He actually became a firefighter, and actually attributes the discipline and structure to being a firefighter to kind of turning his life around before he obviously became the famous rapper. So I think you're certainly onto something there, and I don't know if firefighting in particular is right for you, but if you're feeling a call to,
But, like, I'm sorry to interrupt you as well, but this raft guy was like, oh man, they're crazy. They're out here skydiving with chainsaws, and I was like, man, that is pretty crazy. I don't know if I have that level of presence. But
Yeah.
I could do raft guide or even a wilderness guide possibly, but that's also not easy to get into. I already tried to become a monk or join the National Guard,
Mhm.
but neither of those work out for me at this juncture in my life.
Yeah.
So then I must embrace the greater vehicle, bro. I mean, or the Book of Job. I mean, I feel like they're pretty similar in my view. It's kind of crazy. I don't know, dude. Yeah, that's all I have on my mind right now.
Yeah, it's fair. I mean, and the thing is, look, there's no right answer. I think people find their way, and obviously there's probably multiple careers that can suit you. But what I was alluding to is, with the firefighter aspect, sometimes I think when people are feeling very lost, a sense of groundedness can be very helpful, and jobs that provide discipline and structure and mentorship, good mentorship, sounds like in contrast to what you were experiencing at your previous job, um, may be useful. And then you can find that in a lot of different careers, even beyond firefighting. But I'm saying maybe if there's an intuitive appeal to that kind of structure, it may help you find a little bit more groundedness, which it sounds like that's what you are seeking.
The grounded isn't bad because I feel like with the groundless, I feel like it's not. It would just be too much of a deviation.
Right. Do you feel groundless right now?
Nah, because I feel grounded in groundlessness. I don't know. Maybe I should be more groundless. I don't know. I mean, that's the thing about non-action. It's just very non-judgmental. And
Well, what else do you got going on in your life besides work?
They're making judgments, and I just am in the center, and I'm just still. And I can't really get that much action done, but I also don't have
Well,
action.
yeah, I hear you. What else do you got going on in your life right now? If you kind of left your own job, like how are you spending your days?
Oh man, today was pretty busy. What did I fucking do, man? I went to like the park. That's what I've been doing every day, bro. That keeps me grounded because then I go to the park and then I yell at geese. They're pretty dope. And then okay, and then today a letter from the Department of Revenue, and I opened it, and it was a check from Wells Fargo. So I went to Wells Fargo.
May I reflect something back to you?
Yeah.
I think when as oppressive as work is, which is what you alluded to earlier,
Yeah.
Interestingly, outside of obviously really pressured, stressful environments, is generally good for people's mental health to work. Interestingly, I think that's even more true for men. Because obviously, as providers, there's an increased pressure on men to provide. But yeah, above and beyond that, people have human.
I don't identify.
Yeah. Well, so let me just finish for a second.
Man. I mean, because like I just and kind of letting go of that whole aspect of life, because I mean, I just feel like that's kind of the judging.
Yeah, I'm gonna just chip in here a little bit. I don't think it's actually judging. I think there's an intrinsic role that men have to play, and it's not a judgment. It's sort of the laws of nature. And I think you can obviously make a free choice in terms of whether you opt in and out of that, but it doesn't change the rules of the game in which you're playing, if that makes sense. Other people will, to your point, judge you fairly or unfairly for those things. Now, obviously, it doesn't mean that you need to be a cog in a capitalist wheel, etc. But playing the role that's expected to hold on. Let me finish. Let me finish. No, no. Let me. Is important. And so my little bit of feedback and reflection back to you is it sounds like you're trying to find your way. And I have a lot of empathy for that because you're in between things. And being in between things is a very challenging but potentially creative aspect of your life, because I think you're understanding and rejecting that which you don't want in your life. And that's totally fair. It sounds like you need a better relationship with your boss. You need to find a workplace in which you're feeling valued, and you need to have some sort of connection between your work and your purpose. It sounds like all of those three things were lacking in your previous job.
You are just like talking and talking and talking.
I am is because in the interest of time, I gotta hop on to the next person. So sorry to be a little bit of a radio show host. I have to just kind of nip this in the bud. But I think it would behoove you to try to seek your next position in a way that my reflection, and this is my feedback from just listening to you, is I think you need a little bit of groundedness. Otherwise, there's too much kind of floating around, and structure and discipline and the tendency that you had in seeking a job like a firefighter. Like I said, I don't know if that's the right position for you, would honestly probably do you a lot of good in providing structure to your day. So even in the next couple of weeks, whether or not you find a job, I don't think that's as relevant to having structure to your day, so that when I ask you a question like, hey, how are you spending your time? You know how you spent your day, you feel like it was aligned with your values, and you felt like it was productive in whatever way you define sort of productivity. I think that would give you a lot more of a feeling of satisfaction and fulfillment in your life. So that's my 2 cents. Is I think you got to find something to be a little bit more grounded in how you're spending your time, and then eventually when you find whatever it is, a new job, a new path, a new way forward that is taking up a little bit more of a central position in your life, I think that will do you a lot of good in just giving you something to strive for. Because I think men are quite frankly meant to strive for things. So I unfortunately got to hop on to the next person, but I appreciate you chiming in. Let's continue the conversation over Discord. And I hope you, find a little bit of groundedness in your life.
Have a good evening.
Thank you. Second caller here. Always takes a minute to connect to the audio, so thank you for your patience.
We had a comment via YouTube about tadalafil and its effect on DHT, and how some people may be extremely sensitive to that, and if it's something that every man should do, or is it something that you should consider before taking some type of tadalafil?
Tadalafil's effect on DHT. Tadalafil doesn't, for the most part, have a significant effect on DHT. It's not a 5-alpha reductase inhibitor. I wonder if that person was asking more about finasteride. I'm not sure if that was the question. Because tadalafil shouldn't have an adverse effect. So what was the question? They were just asking about
DHT, and it was finasteride. They took the comment down.
Oh, okay. And was the question just like, what's the effect on DHT?
Yeah, and are some people more
Susceptible to it? Yeah, that's a good question. Sorry. Okay, so if the question is about finasteride or what's called Propecia, let me just make sure, still connecting to the audio. Finasteride is a 5-alpha reductase inhibitor. It's commonly prescribed for male pattern baldness and or enlarged prostate. And by reducing DHT, the idea is that it can alleviate these conditions. Now, that's controversial because androgenic alopecia or male pattern baldness is largely genetic. And for some people, DHT can aggravate it. But there's also people who have high DHT and don't bald at all. So it's not the single causatory factor. It just may be a contributing factor, unfortunately, if you have bad genes and you're aging. It does, but blocking DHT, which is sort of what one of our medical advisors, Dr. Rand McClain, calls sort of the virility hormone. It's responsible for your libido, your drive, your aggression, your competitiveness. It's kind of like male vigor in a lot of ways, vigor or virility. When you shut that down by taking finasteride or Propecia, and it really does actually shut it down. It like puts you down into often subphysiological levels that are technically below normal. So you go from whatever you're at to often below the 2.5 percentile in terms of your DHT. Some people do just fine on finasteride or Propecia. They don't even notice a difference. Some people do experience a loss of libido. And also 5-alpha reductase is not just responsible for the conversion of testosterone to DHT, it's also responsible for other parts of the neurosteroid cascade in terms of like the conversion of things like pregnenolone, progesterone, and other hormones into things like allopregnenolone. So 5-alpha reductase also is responsible for the conversion of progesterone into dihydroprogesterone and 11-deoxycorticosteroid into dihydrodeoxycorticosteroid, which converts into cortisol. And so you're inhibiting these important sort of neurosteroids. And so people do often experience, sometimes it's described as like a brain fog or a decrease in cognitive function. Because allopregnenolone in particular is a GABA agonist. It's responsible for feelings of sort of calmness in terms of brain function. And so it does have basically cognitive effects. And some people are more sensitive to it. And that's the interesting thing about drugs. There's such individual or idiosyncratic responses to medications. Some people feel great, some people feel terrible, and some people feel oftentimes somewhere in between. But because it has such wide-acting effects, I think it's kind of a dirty drug is the way I would describe it. And dirty meaning it's not very specific. It has kind of 5-alpha reductase is an enzyme that converts a lot of different compounds into various compounds. And so it has wide-ranging effects. That's why it's literally used for prostate, it's used for hair, and it has effects on the brain. So it's kind of all over the body. And some people are sensitive to it. Now, the good news is what's called post-finasteride syndrome, which is kind of the permanent sexual side effects that people experience from finasteride, is relatively rare. If you look at the research literature, it's on the order of, 1 or a few percent at most. But the people who get it are obviously very vocal about it, and they're very upset because, well, oftentimes the effects seem to last for a very long time and are not necessarily reversible. Now, how much of that is psychogenic versus a true physiological permanent effect of the drug is unclear. There's a controversy around that as well, but there's been lawsuits about it, and I think people need to be cautious about using 5-alpha reductase inhibitors because of the potential for these negative side effects. Now, look, you can try it and obviously take the risk and see how you feel. There is, like I said, millions of men who take finasteride or Propecia, and they do just fine. I would say, in fact, the overwhelming majority of them do. But it does have a small incidence of a side effect profile that in some cases can be quite severe. I've heard sort of anecdotal examples of that were quite disturbing. So you have to make that cost, you and your physician have to make that cost benefit analysis. We as a company don't like it because of the risk profile. And so when we launch our hair and beard growth protocol, it will not include finasteride or any other dutasteride or other significant DHT blockers.
Cool. We had another question via YouTube. Hi, Dr. Cam. If libido is lost for many years, how likely would it come back with the Maximus therapy, aka the King Protocol? Maybe my brain has forgotten about it. Do you have any experience with this? And then I asked him in context of king or lover. He said about 18 years, have Hashimoto as well, and using anxiety medication for 10 years for context.
Awesome. It looks like we got our one of our callers. Hi there. Can you hear me? Love it. How are you doing, sir?
Good. I appreciate the time, Dr. Cam, but I thought it was going to be like last time where there were going to be a bunch of people on talking about different topics, and I've learned. I'm just about to start both the King Protocol and the Maximus Protocol, and don't know much about it other than what I've read and getting it prescribed and having it. One of them arrived, the other one will arrive on Monday. And so just sort of wanted to know more than leaflet says about what to expect and other people's experience with it, etc.
Yeah, well, it's a great question, and well, thank you for joining. I'm glad to have you as part of our community, or what we call our tribe. What got you interested in the first place?
I think I saw it on Facebook, and I just thought, I've been taking testosterone for several years now, 1 ml every 10 days or so, and using sildenafil and sildenafil every day, 5 milligrams, and sildenafil up 100 milligrams chewed just prior to having sex. So
Yeah.
I was just wondering if it in fact will have me produce my own testosterone, and if in fact the drive will be increased versus the fact that while physical hardness is possible and achieved at 75% of the time, the passion is.
Yeah, so it's a great question. So why don't we just start with the lover protocol? So the combination that we use is, you're familiar obviously with using tadalafil and other PDE5 inhibitors like sildenafil that you mentioned. So obviously that effect will be very similar in terms of just increasing blood flow, hardness, erectile quality. So that will be very similar. Now there's interesting research that shows the combination of tadalafil with bremelanotide, the second compound that we're using, has a synergistic effect in that it actually enhances erectile quality even more than tadalafil alone. So just for erections alone, it seems to be slightly enhance essentially the effects of just taking a PDE5 inhibitor by itself. So that's kind of like bread and butter good news. In terms of the libido or drive or passion, as you put it, yes, bremelanotide in particular, because it works in a totally different way. It's a melanocortin receptor agonist, was actually approved for low libido in women, but there's a lot of studies that show that it also improves libido in men. So that's the unique thing about, obviously, our compound is not only does it have the improvements in blood flow and erections, but theoretically it should have an improvement in libido as well. Now, the one thing I always caution people, though, is libido is the most complex phenomenon. It's a biopsychosocial phenomenon, because is there a magic pill for libido? Really, the answer is no. Bremelanotide is the closest thing that we have. It has been FDA approved literally for that reason, but I always tell people libido is obviously a function of a lot of things. If your stress level is high, it depends on obviously the intimacy with your partner, and if you're having conflict, and a lot of other factors play into desire, passion, and other things.
Yeah, the other stimulator, and the beauty of my wife, and the fact that we don't have a relationship in which we ever have an argument. We're always on the same page.
Yeah.
Great relationship. Those things are all better. It's the physical drive that I may have not seen my term, but I'm 75. I'm 75. I live like I'm 50.
Yeah, great.
I weight wise, I've dropped 30 pounds in the last 6 months.
Wonderful.
I'm doing all the right things, but that is necessary to take 5 milligrams of tadalafil every day, and then supplement it with 100 milligrams of sildenafil to achieve what I'd like to have happen. Is what I'm trying to do, because it's too much. It's too much on my system. To do that on a regular basis, and it's just not helpful.
Yeah, so and that's why we just use the tadalafil. We're not stacking it with the sildenafil that you're using. So I mean, if you're used to that level, it's probably not going to increase blood flow, obviously, as taking that much sildenafil or Viagra. But it is much more of a, I would say, sustainable and theoretically healthy approach. Tadalafil seems to have some sort of anti-aging and just longevity potential benefits as well in terms of reducing the risk of dementia, Alzheimer's. Is very preliminary research, but obviously it improves memory, attention, processing speed, which I think are important things. Obviously, we care about our brain health as we age. So look, the moral of the story is try it out, see how it works for you. You can report back and see. Like I said, everyone's...
The combination of the two protocols, though, is indicated, and
yeah,
they have synergistic effects.
Yeah, because testosterone increases libido through its own mechanism, right? Which is just testosterone and the derivative DHT are responsible for libido. Bremelanotide works through the melanocortin and potentially the dopaminergic pathway. So they're different mechanisms, which is good because you can stack them. And they potentially have synergistic benefits. I was curious because it sounds like you were doing testosterone replacement before, like you were doing injectable TRT. Right. How did that work for you, previously? Did you have any issues associated with it?
No issues associated with it, but I do notice that if I go 2 or 3 weeks and forget to do it, there's a change.
Yeah.
There's a drop. If I inject 1 ml every 10 days or so, it usually will last pretty well till the next stop. And I sort of have a sixth sense that, I don't have it on my calendar, but it's time. And I look back at when I took it the last.
Yeah, that's actually one thing that I think, and there's a good justification for it. I really think there's an advantage of our protocol is because it's a daily oral product. Your levels are just steadier on a day-to-day basis. Like once you achieve sort of serum saturation, which I think basically should occur, after a week or so, you'll have sort of steady levels. Testosterone levels peak by usually day 28. That's why we retest people after 30 days. But after that, your levels are stable. With testosterone shots, the way especially that you're doing every 10 days, you get this huge spike of testosterone, of course, right after the injection. And then it kind of peters off, and you're reporting exactly that. You almost can notice when your testosterone's getting back down to where it was or even potentially lower. So there's more of these ups and downs that people have. That's why, some of the newer protocols have people injecting, in fact, more frequently. But the downside is it's obviously annoying. Like, nobody wants to inject anything every day. It starts to become onerous versus obviously taking a pill every day, much easier to do. So testosterone and enclomiphene do feel differently. Every drug obviously has its own feel, and they work through completely different mechanisms that obviously ours restores your natural testosterone production versus replacing it obviously with TRT. So I'll be curious to see just how it works for you, but there'll be less of the fluctuations. That I can at least almost assuredly promise, in that however you feel, you'll feel more stably on a day-to-day basis.
And based on the blood sample every month, the doctor will adjust the dosage accordingly.
Correct. So after the 30 days, you'll retest. They'll take a look, and then, if you need a higher dose, they'll obviously adjust it. It won't necessarily be every single month. It'll be till you get to the dosage that's correct for you. So whatever dosage you end up at, hopefully that should be your last test. And then because like I said, your levels will be theoretically stable after that, you'll know essentially where you're ending up.
Last question is, I'm going to have surgery the middle of the month. They're just going to use propofol and whatever they use to. Is it okay to begin it prior, or should I wait till after the surgery to begin it, or there's no conflict with that?
I would ask your surgeon about that, because your surgeon and anesthesiologist would know best. There's no known contraindications with enclomiphene, other than sort of taking blood clotting agents. But tadalafil, obviously increases blood flow. So that's up for your.
They know I'm taking tadalafil.
Okay.
Use sildenafil on occasion, at the right time. So they're aware of that, and they're aware of every other medication I take. I just haven't had this thing. It was scheduled before I ordered it. So I just was wondering if since they know I'm injecting testosterone and they know that I'm taking sildenafil, I don't think there's any.
Yeah, I would just bring it up with them.
Drug.
They may not be familiar with enclomiphene, but they should be familiar with Clomid or clomiphene, which is the parent drug. So if you just say, hey, I'm taking basically a form of Clomid or clomiphene, they should be able to answer that question for you. The other thing is the half-life is short. It's 10.5 hours. So if you discontinued it literally even the day before of the procedure, it should be out of your system actually by then, because that's why we do the daily dosing. So you could obviously, if you were conservative or your physicians were conservative and wanted to stop, you could just stop. Yeah, not take it. And there's no discontinuation like TRT, so you're not going to feel bad or anything. You can start and stop. We occasionally have people just forget to take their medications on an international trip, and they skip it for a little while and they get back on it. There's not a particular problem with doing so. So it's up to you and your physician, basically, is what I would say.
Thank you for your time.
Absolutely. I hope it goes well. Wishing you the best, and thank you for being on our protocol, and obviously give us feedback about how it goes.
Thank you.
All right. Let me just... Any other questions?
Yeah, we had a very similar question via YouTube. It was asked just before we started the live coaching session. Back to it. Hi, if libido is lost for many years, how likely would it come back with Maximus's therapy, the King Protocol, and Level Protocol? Very similar to the caller's question. Any experience in that? It's been gone for about 18 years. Unfortunately, has Hashimoto as well, which is an autoimmune disorder. Any contradictions there with the medication, and anything about taking the Maximus medication while also taking anxiety medication for 10 years?
It depends on what medications they're taking. I don't think there's any intrinsic contraindications that I recall with thyroid or at least typical thyroid or anxiety medications. But I'd have to know what medications this person is referring to. There could be off-label use of medications that are for anxiety, etc. So When you fill out the medical history for our protocols, you just report what specific medications and dosages that you're on, and we'll tell you if there's any contraindications that would prevent you from being on our protocol. That's the best way, I would say, to know for sure. I don't think so, at least just if you're taking more typical stuff on the basis of what you're reporting. Now, to get to the question of if you've had lost libido essentially for 18 years, what's the likelihood that it's going to come back? It's unclear. It depends on obviously why. What's the root cause of the loss of libido? If the loss of libido is associated with low testosterone, and it turns out on the lab test that you are secondary hypogonadal, have low testosterone, it's quite possible that being on the King Protocol, if it restores your testosterone production, your libido might come back. If it's secondary to another cause, which is, you got an autoimmune disorder going on with Hashimoto's, and that may be contributing to your libido, we're obviously not treating the Hashimoto's. You're already in treatment for that. And if that hasn't been helping, and that's the root cause of it, then it's obviously not going to help. So I can't sort of predict essentially your treatment response. Now, in general, though, the longer you've had a problem, probably the worse that it is, right? If a good example of this is, let's take the extreme sort of counter example. Libido fluctuates on a day-to-day basis for a lot of people. If you just have a day of bad sleep, a day of high stress, libido will come and go. So if you're like, if someone walked into my office and said, "Hey doc, I've lost my libido," I'd be like, "Well, how long has it been going on?" They're like, "A day or a week." I'd be like, "Okay, what's going on in your life? Has it been an extenuating circumstance or an unusual period of, illness, stress, or distress in your life?" Then I would say the prognosis is pretty good. Now, if you're like, "I haven't had a libido for 18 years," I would say, that obviously makes it more complicated. It makes me wonder if there's a more organic or physiological cause to it. And I also wonder if you said, for 18 years, are you talking about, well, it's generally been low, but has it been zero? How low is low? Has there ever been times where it has been good in the right 18 years? When you've been feeling good, when you've had the right partner, has it come back temporarily, or has it been literally shot? So I think those are important variables, because if there is a glimmer of hope, so to speak, because you see a restoration temporarily or acutely, but maybe it's just not been consistent for the last 18 years. If it's been lower than what you want, but not zero, then the prognosis, I would say, is better. But if it's been flat, non-responsive, 0 out of 10 for 18 years, then obviously the prognosis and likelihood of that it's going to improve is going to be significantly worse. It's also a function, I think, of your overall health, too. Obviously, the sicker someone is, if in addition to the Hashimoto's, I'd be curious about the rest of your medical history. If someone has, let's say, severe type 2 diabetes, there's damage that happens to the vasculature, to the nerves, etc., that influences, sensation, blood flow, all these issues that is not reversible, quite frankly, to complete degree. Now, if you have early stage disease, I do actually think you can reverse early stage type 2 diabetes, or at least put it into remission. I don't even like the word reversal. But at that point, a lot of like the physiological damage hasn't occurred. You don't typically have neuropathy and other issues. But when you get to the severe range of diabetes, you've had it for decades, and you might be even injecting insulin at that point, in which about 10 to 15% of type 2 diabetics do. At that point, some of that stuff is less reversible, and if loss of libido is a complication of that, then I would say it's harder for it to come back. So, long story short, it depends on what's causing the low libido, and if the cause of that is more organic and due to some essentially accumulating chronic damage that's happened due to a medical condition, it's less reversible. If it's due to, let's say, lower testosterone, then in our protocol, and you're responsive to our protocol, then I think there is hope. But we won't know for sure until basically you try. And it's a pretty low cost and low risk test to essentially just try it for a month and see how you feel.
They gave more context on the antidepressant medication known as clomipramine. It's known as an antidepressant and nerve pain medication. Can be diagnosed or used people who have been diagnosed with OCD.
Yeah, clomipramine and brand name anafranils. Yeah, common anti-anxiety OCD medication, and it's a tricyclic antidepressant. I'm curious if this person has noticed that the use of these medications has influenced their libido. It can, these class of medications increase serotonin, and when you increase serotonin, it can cause a loss of libido and anorgasmia, or inability to orgasm. They're common, in fact, side effects of these medications. So that's something I'd want to work out, or you explore with your psychiatrist, is if you're having that, either they obviously need to try different medications that may not have as much of a serotonergic effect, or sometimes they'll add on secondary medications, like a Wellbutrin, for instance, that may decrease some of the sexual side effects from such antidepressants or anti-anxiety medications. That's obviously up to your psychiatrist to kind of work out, but I think it would be worth exploring if it's a consequence of your psychiatric medications. It is common that people lose libido, so I don't know if you've been taking the antidepressants for that long, or it predates the antidepressant or anti-anxiety use, but it may be a contributing factor, for sure. Unfortunately, the more medications you take, you get into what we call polypharmacy, and it becomes complicated because is it a side effect of the medication? Is it a side effect of the combination of medications in which there's drug interaction effects? And not all of these are well characterized, because if you think about it, once you start adding 2, 3+ drugs, there hasn't been studies testing every combination of every medication, out there, and everyone's response is also individual. So a lot of stuff I think you just have to try out under doctor's supervision and figure out through trial and error if it's contributing to some of the things that you're reporting.
He says thank you for all the information. He appreciates it.
Absolutely. All right. With that said, thank you very much, everyone, for joining us today. Hope we got everyone to answer all your questions. If not, please, join us for next week. I got one last question here. On clomiphene, your testosterone levels go up in just 28 days. Yeah, that's when the research shows that it peaks. You can probably see testosterone increases within a week if you retested that fast, but we generally wait until 4 weeks because you kind of want to just let your body adjust and see how you feel with your new hormone levels if it went up, because anytime your hormones changes, it kind of throws your body off balance. You know what I mean? You're finding a new balance or a new normal, and so it takes a couple weeks to just get used to that new normal and adapt. And your testosterone levels should be highest after 28 days. So that's why we test after 30 days. So thank you, everyone, for joining us. Join us on our Discord community, MaximusTribe.com/Discord. If you have additional questions, we have a very active online discussion as well. And I'll catch you next Thursday at 6 o'clock Pacific time. Thanks.
are my sunlight.